healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. Today, we'll be speaking with our special guest, Dr. Brittany Sanders, a doctorally prepared aesthetic nurse practitioner and founder of Top Tier. She's been kind enough to join us for 2 episodes. In the first one, we're going to delve deep into personalized aesthetic treatments, the importance of them, cosmetic medicine, popular treatment and trends, and she'll address some of the common misconceptions that she encounters on a daily basis, her recommendations when treating skin of color, how she integrates wellness, nutrition, and aesthetics, and as well as mental health. If you're new here, welcome to the Melanin Initiative. My name is Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it to manage your health and advocate for others. It's our hope that by watching on YouTube, LinkedIn, Instagram, and soon Facebook, or listening on any of your favorite podcast apps, that you'll be empowered to ask questions, confident to navigate the healthcare system, and educated on how you can manage your health. If you haven't already, please subscribe, give us a thumbs up, leave a comment or two, whether it's on one of the video platforms or audio. It lets the algorithm know that this information is important so that when people like you look for information like this, we'll show up higher in the search results. Remember, this show is for educational purposes only. The opinions expressed here are opinions alone. They are not a representation of any of our affiliations. If you're having a physical emergency, you should call 911. If you think you might be having a mental health emergency, or someone you know could be, you should call 988 or text 741-741. Welcome, Dr. Brittany Sanders.
How are you?
I'm wonderful. I'm super excited. We have talked just a smidge bit about aesthetics, only because Geraldine, she does aesthetics, but that was really more about her and her choices as opposed to information for the public. So this is really our first time being able to do that. And I'm super excited because you just told me you're an award-winning spa owner. So this is really $1 million. This show just became $1 million episode.
Okay, let's go.
So before we jump into understanding more about personalized aesthetic treatments, tell us a little bit about yourself, where you're from, and who you consider family.
Okay, well, I am Dr. Britt, everybody. I am a board certified doctoral prepared cosmetic nurse practitioner, born and raised in Detroit, Michigan. I'm also your med spa coach, and I also consider myself the antidote to aging because I specialize in a lot of um, anti-aging procedures at my spa. Started out as a CNA, went from a CNA to an LPN to an RN, then went and got my master's degree as a nurse practitioner, and then my doctoral degree. Shout out to all my nurses out here, okay? Nurses are dear to my heart. But just like a lot of nurses, just wanted to try something different, wanted to step outside of bedside, and wanted to allow my nursing degrees to work for me.
We love it. What up, though?
Detroit.
Yeah, so we do a series that we do here actually. It's called Becoming Doctor of Nursing Practice, just to
Okay.
inform the public, one, what it means to be a doctorally prepared nurse, but also to inspire the next generation, whether that's young students entering the industry for the first time, or we know a lot of people come into healthcare as second and third career choices, right? And they have a lot
Mhm.
of questions. And so he comes on every semester just to kind of so we can follow his journey and learn that way. And he's from Detroit, and he is the reason he gave us a referral. So the producer of this show came through him, and my goddaughter actually lives out in Detroit too. So I love it out there.
Nice, nice.
What kind of nurse practitioner?
And thank you too. I appreciate you all for reaching out to me, asking me for this interview. So I don't want the interview to go past without thanking you all too. I'm very, very appreciative. I love everything that you're doing as well. So I am a family nurse practitioner, FNP.
Oh, okay, just like Geraldine. And where did you go to school?
I went to school for my nurse practitioner degree.
Whatever ones you want to recognize.
Because I went to a few of them from, like I said, I was a CNA all the way to FNP. But I got my master's degree and I got my bachelor's, my master's, and my doctorate actually from Chamberlain University.
Okay, shout out to Chamberlain. That's wonderful. And what inspired you to go into nursing?
Um, just always wanted to be a nurse. Ever since I was little, always wanted to be a nurse. Where I'm from, I always wanted to be an RN specifically. Um, always loved helping people. Always um had a good heart, good soul. So I felt like that was the route I was supposed to take. And then where I'm from too, like being an RN, let's just be honest, being an RN is like top dog, you know. So I started out as a CNA and LPN, but I always wanted to be an RN. Um, just to be able to take care of myself, right? Not only am I taking care of others, but also being able to take care of myself as well too, and helping everybody.
And a little bit about the event you attended this weekend.
Yeah, so I just attended the Black Spa Expo. It's called, I'm a part of the Spa Boss Tribe. The Spa Boss Tribe is a lot of black women. It's actually black men and black women and men, but this group it caters to black spa professionals. So whether you're a nurse, whether you're an esthetician, whether you're a lash tech, or nail tech, or artist, or whatever that you do in the beauty industry, it's called the Spa Boss Tribe. They cater to black spa professionals and helping you market your business, expand your business, and also educate you on a lot about the knowledge in the spa industry. And I was awarded this weekend. Woo! I was awarded the Business Mogul Award for being one of the black spa owners in the Spa Boss Tribe.
That's awesome. Congratulations. I know that takes a lot of hard work, and we'll learn more about that in your next episode, specifically what it means to be an aesthetic nurse practitioner and also an entrepreneur. So make sure you tune in for that. We'll have the links in the description box for that, as well as for the, let me get this right, make sure I got it. The Spa Boss Tribe, right?
Yep, the Spa Boss
That's
Tribe. Yep.
wonderful. We love to hear about community. We never want to encourage nurses to continue to suffer in silence and think they have to figure everything out on their own. So much value in community.
Yeah,
So,
yeah.
how do you describe aesthetics?
So I love aesthetics. Aesthetics is anything. Honestly, to me, it just means that anything that makes you feel good, right? Aesthetics can be anything from like beauty or like massages or like facials or anything that makes you feel good about yourself, that makes you feel confident. So, that's how I would describe aesthetics because in my spa, that's what I do. I bring back women's confidence.
We love, you said women?
Yeah, women. Actually, well, women and men. Actually, most of my clientele is women. I do treat some men too, but most of the time it's women.
Okay. And then what would you say is the importance of developing personalized treatment plans when it comes to cosmetic medicine?
Oh my God, it's so important because I always get a lot of messages on DM, and the first thing they ask about is like, well, what's the price? You know, how I get started. And one of my number one responses is that we have to build you a customized treatment plan because um, I can give you a price because not everybody is treated the same. There are so many things that bothers people differently. Like I might have some clients that come in, they may want their face done, they may want their body done. So yeah, building customized treatment plans are very important because everybody has their own thing that's bothering them basically, right? You got some people that maybe their eye bags may be bothering them, some people their chin or maybe a body injectables. So I always tell my clients to start with a consultation so I can get to know you and I can build a customized treatment plan for you. It's so important because um those patient-centered values, right? What may be bothering you may not be bothering something else. So um building a customized treatment plan is very important so I can address your personal needs.
I would assume that that's even more important when people have social media, that they're sending you pictures and videos saying they want to look like that.
Mhm.
Is
Yeah,
that a
yeah.
big thing you have to like counteract?
Yeah, people send me stuff all the time. I have a lot of women that come into the office. They're like, "Yeah, I want to look like this," or "I want these kind of cheeks. I want this kind of chin." So when they come into my office, I really evaluate them because it's all about facial balancing, right? One thing about me is I specialize in natural results, right? So I don't like to just and people think when they hear aesthetic procedure, they just think that their face is going to be transformed. But I really educate my clients and let them know that I specialize in natural results. I'm a person that I never want to do too much, because if you do too much, you can take it away. We always start low and go slow and do one step at a time, right? So that way you could tell me if you need more instead of me suggesting, and we could just take our time as we do those procedures, right? Um, so yeah, that's very important. I have a lot of women that come in, they say they want this and that, and it's my job to educate them and say, hey, no, you actually need this, and hey, I think we're going to stop here, because the reason why cosmetic procedures have a negative impact is because sometimes women or people in general, they just go too overboard with the
Mm.
procedures. So it's my job to kind of like, hey, you know, this is what you need, and I think we should stop here. You look great.
Do you find that people have been pretty receptive to the education?
Oh yes, yes, yep. Yep, they really are, because once you tell somebody and you really, and that's the thing too. I do a lot of education in my spa. I'm always constantly telling people about what Botox is, what Botox does, what filler does, what it's supposed to do. And when I actually educate them and tell them my perspective, they actually are receptive to it. And I think that's why that's another reason why I'm sitting here talking about it. That's another reason why I like aesthetics, because as nurses, and you work in, or I became a nurse practitioner, I should say too, because as nurses, you have to follow orders from a doctor. You have to follow that chain command. You have to do whatever they tell you you have to do, and there's no real input on the patient's treatment. As a nurse practitioner, you get to form the personalized treatment plans, right? You're the person in charge. You're the person that says, hey, you know, this is what I feel that we should do based on my experience, based on my knowledge. This is what I feel that we should do. And most of the time, when I let them know, you know, what my experience is, what my knowledge is, they are very receptive to it.
So that's a perfect segue. Let's start talking about it. What is Botox?
Yeah. So Botox is a neurotoxin, okay? And basically what it does is it's a medication that we inject into the muscles to help paralyze that muscles to prevent it from moving. So it kind of relax those wrinkles in your face. You know, as we grow older, we start to have those wrinkles on our face. Everything starts to sag. So what Botox does, it kind of relax that those muscles that you have in your face to give you a more refreshed look. So you know, around the holidays when your mother-in-law come around, if you don't like her too much, you know, she won't be able to see those facial expressions. But also to it basically combats aging. If you ever look, always rephrase to those ladies in the grocery store lines. Nothing against them, but usually those are older ladies retired, and you see a lot of those wrinkles on their face. When you actually relax those lines and those wrinkles on their face, they look a lot younger than what they actually are.
And where can you get Botox?
Where? Like in the areas in your face?
Well, your face. I've seen some videos where people are using it to treat hair loss.
Yeah. So I was gonna say, like, you can actually get Botox a lot of places. Most common places are the forehead area, the frontalis muscle, around your eyes, those crow's feet, the here, the glabella region. I even have people that do the underarms to prevent sweating. We do it in the hairline. Um, we can also do it even in the buttocks area to just give you like a butt lift. We could do it in your neck. It's a lot of places that you can get Botox. That's why I like to do those consultations and have those clients come in where we can develop. So you could tell me, hey, what's bothering you, right? After you tell me what's bothering you, I'll be able to build that customized treatment plan.
Oh, okay. And then, do you use it also to treat people who get migraines?
I don't do it in my office, but there are neurologists that do it. I don't actually do it, but I have had some clients who came in, and once we treat the forehead area, the frontalis, they do say that that does help with headaches. But for actually headaches, you actually have to actually get it inserted into your head,
Mhm. And so,
or
if
like the.
someone's interested, oh, mm. If someone's interested in having Botox, how should they prepare for that visit?
Well, the first thing I always tell people to do is you want to start with a consultation. Okay, you can Google online. Once you Google the practice online, go visit their Facebook page, go visit their Instagram, look at their website. Right, make sure they are a reputable person. We do, sad to say, that we do have a lot of people out here who are administering these procedures who are not healthcare professionals. So you definitely want to make sure that you look up these individuals, make sure they're legit business, give them a call, right? Don't just go ahead and pay something online. Give them a call. See if you can set up an appointment in their office. Do a consultation first. Once you do your consultation, look at the office, look at the area, ask that person about their credentials, and then tell them to provide you education on what Botox does, what it is, what kind of medication it is, and then the areas that they should get assessed, and then go from there.
Wonderful. Is there anyone who's not a good candidate for Botox?
Yeah. So there can be a few people. Of course, we have our pregnant and breastfeeding people. I love them, but they're bad for business. Pregnant, breastfeeding, it could be anybody who has allergies to Botox. There are specific medications. Again, that's why that consultation is crucial, because once you go in and see your provider, whether they be a nurse or a doctor, make sure that you tell them what kind of medications you are on, because there are specific medications where you are not allowed to get Botox. So that provider will look at your medication, look at your medical history, look at your allergies, and then they will decide if you're a good candidate.
And is Botox a threat to the baby? Is that why pregnant and breastfeeding women are not good candidates?
I don't want to say it's officially a threat. They just don't have a lot of research when it comes to how it affects the fetus. Yeah, there's just not a lot of research that has been done where women who, just like medications, there's not a lot of research. So they just say, hey, don't get any Botox or fillers or any cosmetic procedures while you're pregnant.
Okay. And so how does that compare to filler?
Filler. So I'm glad you asked, because a lot of people think that filler and Botox are the same thing. And I actually thought it was myself. I was like, wait, they're two different things. So filler is just as what it says it is. It fills an area up, right? So Botox, it's a neurotoxin. We are trying to relax those wrinkles in your face, versus filler is trying to fill the area up. For example, a lot of people they come and complain about their smile lines, nasolabial folds. They have very deep lines here when they smile. So we want to kind of fill the area up, as well as under eyes too. A lot of women have bags, or they have a sunken look. So we use filler to kind of fill the area up. Or we have women who don't have a projectile chin and they want them more contoured look. So we'll give them filler in their chin. It just kind of fills the area up. It also helps with hydration and contouring as well too.
And is there anyone who's not a good candidate for filler? Is it the same people?
Yeah, it's kind of like the same people. Yeah, same people. You definitely want to check and see if they have like allergies to it, pregnant, breastfeeding, and then there are specific medications that are not recommended, like especially with people who have serious pre-existing diseases, as well as autoimmune disorders too.
And so you said you really specialize in anti-aging, right?
Hmm.
And so how do you describe that, particularly for communities of color who it's my opinion, when we hear anti-aging, we don't think that we are part of that conversation because of the whole black don't crack. And so that whole aesthetics has really been kind of a newer trend in communities of color.
Yeah, yeah. So and that's kind of what I educate a lot on, right? Because all our life we have heard black don't crack, we don't need this, we don't need that. So the most people that I do educate in my office are black women, right? Because we don't think that we need these anti-aging procedures. So anti-aging is my phrase. I always say, look, we can't stop aging, right? We can't stop aging, but we can always slow it down. So when I say anti-aging, I'm trying to slow down the aging process. I'm trying to prevent you from looking a certain age before you become that age, right? Or when you get that age, you don't actually look that age. So that's what these procedures do. They are non-surgical procedures, and they help prevent the aging process. For example, like I said before, I had a client to come in my office the other day, and she had like a lot of wrinkles on her face, a lot of um I should say like facial fat pads. When we're young, we have a full face. Everything is all pushed up. And then as we age, you can thank gravity. Gravity kind of pulls things down. As we lose weight too, we start to get a sunken look in our face. So that's what fillers and Botox does. It kind of provides, it replaces that volume loss. It replaces the volume loss in your face, and it also relaxes those muscles in your face too, to give you a more refreshed look. So that's what anti-aging does.
Ah, I love that. And that goes back to what you said when a lot of practitioners who, like to promote that they provide natural look is you're not trying to make someone look like someone else. You're just trying to make them look more like themselves.
Yeah, enhance their natural beauty. That's what we focus on, enhancing their natural beauty. So I have a lot of black women that come into my office and they're just like, oh, I seen your post or I seen it. I'm not sure what I need. I don't really think I'll need it, but I'm not sure. And then that's where I provide the education. I say, hey, we're gonna start low, we're gonna start slow, right? We're just going to work our way up. And a good thing about these procedures are they are reversible. They're not permanent, right? So let's just say if you were to get a filler, you can dissolve it. If you were to get Botox, it wears off after a few months. So it's not like it's permanent too. So I try to educate a lot of women and just let them know that um, these procedures or these aesthetic procedures are here to help you. They will not harm you.
And so that's a great point. So if you go one time, you'll have to continue to go back for maintenance, correct?
Yeah. Botox is usually done about 3 times a year to get the to get your maintenance done and keep up with. It is something that you have to keep up with. I do want to dead one of the myths. One of the myths that we hear a lot about Botox and fillers, like, oh, if I get it done one time, I'm just gonna have to keep getting it done,
Hmm.
or if I get it done, I'm just gonna look worse than what I went before. That's not true. It's not that you have to keep getting it done. I think that a lot of people they just like the look. They just like how they look once they get it done, and they kind of like that look. And then you will never go back to work being worse than you were before. If anything, you always just go back to baseline on how you started.
Hmm. And do you have any age restrictions on the people that you are comfortable giving Botox or filler?
Yep, I usually stick to. I think legally you can do it to anybody that's 18 years of older, and they can consent to it. For my practice, I like to at least stick to age 21 up and older.
Oh, okay. And then do you do laser?
No, I don't do lasers. I haven't gotten into the lasers.
Hmm, okay. What other treatments do you offer?
So I do Botox, your filler. I do microneedling for skincare as well as chemical peels for skincare. I also do medical weight loss, liquid lipo. I do butt fillers, the non-surgical BBLs. I also do medical wigs as well too.
What's the last thing you said?
Medical wigs.
Medical wigs?
Mm-hmm.
Oh, what is that?
So a medical wigs is also known as a cranial prosthesis. It's for women who basically have a diagnosis of maybe kidney failure, maybe they're on dialysis, maybe they have cancer, maybe they have alopecia from blood pressure medication or thyroid medication. Any woman that's suffering from hair loss related to a medical condition, your insurance company will actually pay for you to have a cranial prosthesis, which is a medical wig.
Is so I've never heard this. So what is it?
So it's really just a regular wig, but they
Uh-huh.
just have the terms medical wig because it's your hair loss is related to a medical procedure, and
Mhm.
in the medical terminology or when we build an insurance company, we have to use the terms medical prosthesis, but it's just your normal wig. It's not like a specific kind of wig you have to measure. It's just a regular wig. It's just a term that we use.
Okay, and you'll do that. You'll purchase it, apply it, and everything.
Yeah, so in my office, I'm basically like the middleman between the insurance company and the client who receives the wig. So when a client comes in, they come in for a consultation. We kind of ask them about any medical diagnosis that they have. We use that information. They get the order from their doctor. We use the information to build the insurance company. The insurance company will pay us for the wig, and then we go out when we have wig vendors, and then we'll get the wig from them, the wig vendor, and they come out to our office and pick up the wig and get a size for it.
Oh, okay. Wow, that was interesting. And then, oh, let's talk about what microneedling is.
Hi, I'm Alicia from the Melanin Initiative podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1 minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
I've done it before and I love it.
Yeah, I love it too. Actually, I done did all these procedures a lot. I done did a lot of them myself. But yeah, I love microneedling. I'm actually going to be doing that pretty soon within the next week or so.
Oh,
Um, what microneedling is basically small, tiny needles that are used to cause small injury to the skin. Think about it. Once you cause injury to the skin, what happens? It sends these little messages up to your brain that says, "Hey, something is going on down there. Send skin repair the skin." So when we use microneedling, we kind of just basically tells the body to repair new skin. So microneedling helps with skin tone. It helps with acne scars. It just helps with smoothing your skin overall. That's one of my popular services.
yeah, and boosting collagen. And
Collagen.
I think it's a great introductory kind of advanced procedure because it's not quite late. If you're a little bit scared of like the late, if the other words kind of sound scary, and I just think
Yeah.
that one is like a good intro. You can get your feet wet. You don't have to, take off work or anything, and it's not too big of a hit from the pocket, also
Right.
because aesthetics does cost some coins now.
Yeah.
And I think that's a good way to get in, and it's a great gift for anyone who's looking to give someone a gift.
Yeah, it is. I love it. I have done chemical peels, and I like to go back and forth from like chemical peels to microneedles. So I did my chemical peels. Now I'm gonna move on to the microneedle one. I like to do those more like in the fall, just because you don't want to be in the sun a lot for those.
And then for your microneedling, do you do like stem cells or exosomes?
Oh look, you know a lot about these aesthetic procedures, huh?
Mhm. Yeah, I'm kind of
You're glowing
yes, I love
too.
derm. Outside of this podcast, that's what I spend most of my time on.
Yeah, your skin looks good. And you know what? That's what I when I first became an MP. Now that I'm in aesthetics, I think I had started out in like pediatrics, but now if I knew that I was going to do aesthetics, I wish I would have started in derm. So anybody out there, RN looking to become an MP or a new MP, definitely try to see if you can go into a derm office because you learn a lot about the skin, and the skin is the basics of everything in aesthetics, right? Learning about the skin. So I wish I would have started out in derm, um, but it was a question that you asked me.
Oh no, that was it. And actually, so I was gonna actually ask your advice, and you just gave it. About for people who, because I get it. So there's been an increasing
Oh,
trend.
exosomes. That's what
Oh,
it
that's
was.
what it was. Yeah, yeah.
Okay, so you can do microneedling with PRP, which is plasma rich platelet. That's where you draw somebody's blood, you spin it around in a centrifuge, and you kind of grab those platelets from it. You can do that, but I actually use stem cells. I use stem cells. I like those a lot better because those are donor stem cells that comes from people who are much younger. Because if you think about it, um if you were to say if you have a client who's 60 years old, right? They come in, you draw their blood. We're looking to get those platelets. Those growth factors are not really moving like they're supposed to. So I like to get stem cells, which are donor stem cells from much younger clients, which means their growth factors are a lot more better than my older client. So I use stem cells, but I'm starting to get into the exosomes too, because those exosomes are a lot more better than stem cells.
And so, what are chemical peels?
So chemical peels, is basically, how should I put it? It's a chemical that we use that we put on the face to basically take off that first layer of skin. Chemical peels can help with like the skin tone. They can help with the brightening, but they really put all of that like junk and everything off the skin, just to kind of help you better with acne. It's real simple and it takes about 30 minutes. And yeah, you will peel for maybe about, you usually start peeling around like day three, and once you have that first layer of skin, you'll start to notice that even like the dark marks that you have starts to lighten up.
And are there any people who are not good candidates for either microneedling or chemical peels?
So it will be people who, for one, who like to sunbathe. Those are definitely not good candidates. You're pregnant or breastfeeding clients. There's not a lot of medication restriction, but I will say like people who are on Accutane, things like that. Those, that's why it's crucial that you go in for that consultation and get assessed and you have a good paper exam, so we can definitely look at all your medications that you're taking as well as your medical history. But off the top of my head, just usually people who may have strong allergies to different things, pregnant or breastfeeding, and who may be on specific acne medication.
And for those of you listening, you're not familiar with Accutane, it's used to treat severe acne.
Mhm.
It's really important that we address skin of color when it comes to these aesthetic treatments, right? There's been some kind of scary pictures going around the internet, and we know there's a lack of diversity in dermatology when it comes to education, textbooks, images, providers. And so it's important that we provide that information and that patients know that not everyone's well trained or competent in that, and that they shouldn't do all the things they see everyone doing.
Right.
And so, what's your advice for skin of color patients looking for these aesthetic treatments outside of the consultation?
So actually, you know what? That's why another reason why I opened my practice in the beginning is because I wanted to create a safe place for women like me who can come and get these cosmetic procedures. Um, it's just we just feel more better when people who looks like us and understand our skin. So I just feel like in my area there were not a lot of black owned med spas who cater to women who look like us. So I wanted to solve that problem. I wanted to close that gap, so I opened up my spot. So I can't. Yes, I do have all patients. I treat all diversities, but people, a lot of women come to me specifically because I am black. So again, just really doing your research, right? If you have some black spas in your area, I would definitely say, go to them. They might be more familiar with your skin tone as well as black dermatologists. But just really do your research, see, look at the page, look at the website. Are they treating other black clients? How were they before and after? How was their results? Look at the reviews. I just don't ever want to tell nobody not to try it or don't go anywhere. It just really comes down to like just doing your research and make sure you're going to the correct procedure. And really, when you're in that office, talk to that provider, ask questions. Don't assume because they are a business owner or they're a nurse or they're a doctor, they just know everything. Ask questions for yourself. Hey, have you ever dealt with somebody with my skin type? Is this okay for my skin type? Do you have any before and after pictures? Can I see on your website? So those are the things I would suggest, because I know, like I said, I'm in Detroit, but I know this podcast is like all over. I know we're gonna have people all over for watching. So I just want to say, definitely just do your research. Start that consultation is crucial. That will tell you everything that you need to know. And if you go into the office, it doesn't look right. It doesn't feel like the provider is not connecting with you. They're not asking your questions correctly. They're not giving you aftercare. They're not giving you before care. They're not assessing your allergies, your medications, your medical history. That may be a red flag that you need to maybe go to a different office or reach out to somebody else.
Yeah, and we'll put some resources in the description box for both clinicians and patients that can help educate all of us more. And so, as we close out, let's talk about how you integrate wellness, nutrition, and mental health into your practice.
All right, so um, I'm always create. So mental health is very big because I am in aesthetics. I do deal with some clients who have body dysmorphia, some clients who come in there and may say they need this and they really don't. So how I integrate mental health into my practice is just really like getting to know my patients, right? I'm very personable. A lot of times we're in the office, we're talking about our families. I'm getting to know them because really you're building a relationship. So I think that And people like these procedures are not covered by insurance company. You do have to pay cash or get on a payment plan for them. So building that relationship with my clients is very crucial. Talking to them, seeing how they're doing, assessing them, and seeing if they're a really good candidate. Because even though they may have the money and they may be a good candidate, I also like to make sure they have the mindset for it too. Right? There are clients that I have turned away, because I'm not comfortable with doing a procedure because I feel like, hey, you already have enough, you don't need me, you look good, and I have no problem with doing that. So I think integrating mental health is just building that relationship with them, assessing them too to see where their mindset is, and also to assessing their expectations too. You have a lot of people have like certain expectations. Like for example, I had a client who came in. Um, she had got pregnant, and during her pregnancy she ended up getting eclampsia. She ended up having a stroke, and her face was twisted kind of raised on one side. And she really came to me. She really wanted help. She wanted to see if some Botox or some fillers or even some PDO threads can help her. And I was just honest with her, let her know, like, hey, um, there's only certain things I can do. I can do this, but I can't do that, right? So you may want to see somebody else for that. And we sat and talked for a long time, and I was just like, I'm sorry, sorry that happened to you. And so just kind of building that relationship with them, giving them resources where they can reach out. If I'm not able to do procedure, giving them somebody who can, um, giving them surgeon resources or just somebody to talk to. How I integrate wellness is because, for one thing, I always approach a client holistically. Okay, so when the client comes in and they have a certain procedure that they want to do, I'm looking at them from head to toe, right? If you just come in and say, "Hey, I want liquid lipo," when I know that you actively need to lose weight overall, we're going to talk about that. It's not just about, oh, we're just going to do liquid lipo. So I think that I integrate wellness into my practice by looking at the patient holistically and treating their mind, body, and soul, so they can reach their ultimate goal.
Yeah, I love that. And I think that's because earlier when you talked about doing like the Botox and the buttocks, I'm thinking like if I'm going in and I only know that Botox can get done in the face, when I'm talking to you about my concerns, I'm thinking I'm only going to tell you about the concerns in my face. But yeah, when you provide this holistic assessment and you start asking questions about my whole life and all my concerns, then it's like, oh, now I have the opportunity to learn that now I can go in other places and you can help me beyond what I came in the door requesting.
Yeah. Yeah, because the people like, yeah, I want Botox here. So then I educate them and say, well, actually, you need filler there. That's actually used for filler. So we can use some filler to kind of replace that volume loss there. Then our client's like, yeah, I want to lose weight, but I only want to lose weight in my stomach. Okay, well, let's not lose weight overall. Let's just target the stomach area, right? So it's crucial that that you assess these clients, that you ask them the questions, because we know, like, it's cosmetics. If they're not happy, they're gonna come back to you. So being honest with your clients, being upfront, and really asking those crucial questions really helps build that personalized treatment plan. And then we always go over the plan and say, hey, are you okay with this? And then we move forward.
Yes, I think that's super important. And do you do anything in particular with the nutrition outside of the weight loss
So
medication?
we do offer, like, with my weight loss program, it comes with a meal plan. So you
Mm.
get the meal plan, you get the weight loss guide. We also give our clients detox tea as well too. I'm really big about that because usually for the weight loss program, we offer like semaglutide, Ozempic, tirzepatide, all the GLP-1s, and I kind of let these clients know, like, hey, you may only be on this medication for 3 months. What happens after that? So when they come in, I'm letting them know this is a lifestyle, right?
Mm.
So I'm not just, oh, I want to give you a shot and send you on your way or just send you the medication at home. Like, no, you need to follow this plan. You need to make sure and I think that's why a lot of my clients have been successful because I'm not just passing out a shot. When they first come in, we're getting lab work, we're doing the consultation. I am very educating them so much about the diet and the exercise, right? I let them know, like, this is not just a skinny shot. You still need to diet and exercise and do your work as well too. So we definitely incorporate that in our wellness program.
Wonderful. And so one thing we like to do here, since me, Alicia, and Geraldine were three Black straight women, we like to always make sure we're thinking about people who aren't sitting at our table. And so we think about those vulnerable populations. So we'll go down the list of what we consider vulnerable populations and see if you have any special considerations or advice for these groups, or if you have any certain special services. So do you do anything for children?
No, I don't do anything with children except for love them.
And what about advice for them, right? Because they're on social media and they see these images.
Hmm. Um, my advice to any children who's looking at these procedures, like I said, like I have had women, I have 17-year-olds old, 19 years old. They contact me and try to do these procedures, and technically, like I said, they're 18, they can get them, but I always wait at least until they're 21. My advice would just be to just educate themselves on the procedures, understand that they are not fully developed, right? So there might be, it may not be time for them to have certain procedures, and just to love themselves, right? Just to love themselves. Like, that's, I mean, I don't know exactly like what to say, but just to love themselves and know that if you are experiencing a problem, or if you do have a concern, what I would say, talk to your parents, right? Because not even cosmetic, it may be an 11-year-old who's dealing with, struggling with their weight, who's getting teased at school. Talk to your parents about it. If you can't talk to your parents about it, talk to your teachers about it. Talk to somebody about what you're going to, so they can help you physically and mentally through whatever you're going through. So that would be my greatest advice. Now I'm sitting here thinking about it. Talk to somebody, talk to a provider, talk to your mom. You can talk to your mom or dad, talk to a family member, talk to a teacher about the things that you are experiencing.
I think that's great advice. And can you just briefly say what body dysmorphia is?
So body dysmorphia is I would describe it as a person who is obsessed with how their bodies looks. Like, even if a person may feel that they are you may, for example, you may have a person who is very small, but they may look at themselves and look in the mirror and consider themselves big. It's like a person who's never really happy with their body, no matter what they do. They're just not happy with the way their bodies look, even if it if to themselves, I mean, even if to somebody else they look good, to somebody else they may not look good. And I think actually we deal with that a lot in the Black community, because we have a lot of women who want a butt, who want a flatter stomach, because in society that's what's put out there, and that's what's, considered like a nice body type. So I just think that somebody who's not really happy with their body. Even if they do look good, they're just constantly trying to do things to their body to reach their goal.
And your advice for those people?
My advice to those people will, again, definitely talk to somebody about it. Seek counseling. Uh, Talk to a professional in healthcare, whether that be aesthetics. I deal with clients, like I said before, who have body dysmorphia. I have clients who's 130 pounds who wants to come in for weight loss, right? So I would just say, just really talk to somebody about what they're dealing with and how they can help, because a lot of things can be mental.
And that's okay, right?
Yeah, it's okay.
Yeah.
It's okay.
What about retired adults?
Say that one more time.
So we talked about children as one of our vulnerable populations. What about retired adults?
Yeah. So retired adults, my advice for them would be to, if their experiences, because we're aging, right? Our retired adults are aging. That's actually one of my most popular populations, because they are aging. So if they feel like something is bothering them, they feel like it's sagging, their face is sagging, or they have a lot of volume loss. My advice would be to them, like, if it's something that's bothering you, go in and see somebody. Talk to have a conversation, have a consultation. I know some people may say, like, well, I'm retired, I may not have the money. You may not think you may not have the money, but there's also payment plans available too. I'm a person, like, if it's bothering me, I'm going to do something I can to fix it. So my advice to them would be to just seek out a healthcare provider, seek out a spa professional, seek out a nurse or a doctor. Just make a consultation, make an appointment. It won't hurt just to go in there and see what can be done. Because a lot of times we think, like, oh, things can't be done. Because for years we didn't even know Black women did these things, right? We
Exactly.
celebrities were doing it. Black women were doing it. They just never talked about it.
And
That's
that's
what
why
we doing the
social
stuff
media
on
has been
purpose.
so great for that, because now you can see people who look just like you, your same age, even older, who you think, oh, they don't, if I can't afford the money, you look at them and you think, oh, they couldn't afford this treatment, but they look like normal people. And you hear their concerns and their journeys has been just like yours. And they come out just looking like a refresher 10-year version of themselves, not somebody that's going to be like in a movie, like themselves. And I think that's been so encouraging for the public. And that's why I think we've seen this trend, particularly in our community, of us being interested in aesthetics, because it's like, oh, I'm just going to look like the way I feel on the inside, especially
Yeah.
because a lot of older adults are continuing to live very active, full lives, and they still want to date, they still want to be in love, they still want to take their pictures. They're on social media.
They're coming in and get their booty done. Okay, they are coming in, and I love it because you can't put a price on confidence.
Oh,
You
yeah.
cannot put a price on confidence when you feel a certain way and you look a certain way, and actually you feel the way you look. Like you are unstoppable because everything is here, right? So when you have that confidence, you're going to work better. You're smiling every day. You're treating people different, right? You're not upset because you look and feel amazing. And that's what I do for women. I kind of bring back their confidence. I have
Yeah.
clients who came in who were 300 pounds and they lost this weight. They came in, a lot of them, I have a few clients who came in, head down, not really trying to give eye contact, not really looking at me. And when I see them in a few weeks to a month, hi, Dr. Brad, how you doing? The confident level is just changing. And that's what really keeps me going. Like I have some women, I done did procedures, and literally because these procedures are so instant, some of them are like instant results. And because they are so instant, they have cried in my chair. Like literally after I did the procedure, I gave them the mirror and they have cried. So that's very heartfelt. I really don't like when people cry on me because I'm like, oh no, I'm gonna start crying. But it just reminds me of why I do what I do, and I love it.
And I think that humanizes the aesthetics part and helps people realize it's not just about, the vanity of it.
Yeah, yeah, because you might have someone that just have cerebral palsy, and maybe they just have a crooked smile, and literally, if we put just a little Botox there, that kind of helps bring down their smile. And
Hmm.
now they can smile regular, and now they're not getting looked at, and they're not getting teased. So it's not just about like you said, vanity or wanting to look a certain way. It's about enhancing women's confidence. You got women who have bags under their eyes, and we put a little filler under there, and they're not as poofy. They don't look, as poofy. So um it's just about just enhancing that natural beauty and bringing back that confidence that you once had.
Any special services for veterans?
um Well, veterans can really be um, anyone, but we don't really have like any special service for veterans. Sometimes we do run specials where we do have like different specials. Like if you're a veteran, if you're a teacher, if you're a nurse, we
Hmm.
do have certain specials that we run for Pacific populations.
Oh, okay. Any gender affirming therapies?
Say that one more time.
Gender affirming therapies for the LGBTQ plus community?
Um, No, I don't really do like a lot of like hormone replacements. I do service the LBGY community, but it's mostly like for Botox or like fillers.
Okay. And how can people get in touch with you?
Alrighty, so I am Dr. Britt. You can find me on Instagram at Dr. Britt, Britt. That is my personal page. Um, and then you can follow me on my business page where I have the spa at Top Tier Wellness and Beauty. Again, that's Top Tier Wellness and Beauty.
And any last words you want to leave with the audience for those who might be new to aesthetics?
Yeah, so um, first of all, if anybody is new to aesthetics, you're thinking about a cosmetic procedure, again, start with that consultation. Do your research. I know we hear it all the time, but when I want to actually say do research, I'm actually telling you what the research is. The research is look up their website, Go to their Instagram page, look at their before and afters. Make sure they are a healthcare professional, meaning a nurse or a doctor, okay? Make sure that they have credibility. Make sure you go to the location, you do a consultation, meet that person, make sure they are assessing your allergies, your medications, right? So that's my last words because, like I said, we have had some horror stories, and it mostly is because it's related to people who are getting services in the basement, getting services by people who are not healthcare professionals. So really research the person who are you are thinking about getting a cosmetic procedure from, and look at their reviews, look at their work. Okay. Secondly, to all my nurses out there, if you are looking to get into aesthetics, people always ask me this question: how did you get into aesthetics? How did you get started? My simple answer is always start with the class. Okay, always start with the normal Botox and fillers class. See, is it something that you like to do, right? Before you dive deep and open up your own practice, um, see if it's something you like. Google your local Botox and fillers class, and then go to the class. See if it's something that you can do, right? See if it's capable. I do offer classes myself in my spa as well. So I do have women that travel all over the country. I actually got a class this weekend. I got women coming from Texas, Ohio, as well as Louisiana. So I do offer classes as well. The difference between my classes that not only do I teach you the skill, I also teach you the business side of things. Because I feel like as nurses, we can learn a skill tomorrow. We don't have no problem with learning a skill. We just need help with business and marketing. So I teach the skill as well as business and marketing, and I do offer a mentorship program. But again, my nurses, whether you choose me or not, definitely start with a class in with Botox and fillers, and then kind of go from there.
Well, and is all that information on your website?
Yep. So my website is toptierwellnessandbeauty.com. Once you go to toptierwellnessandbeauty.com, there is a spot on my website that says training. If you click the training tab, you'll be able to find more information about the training.
Wonderful. And how long have you been in business?
So I've been in business almost 2.5 years now.
Oh, okay. Very good.
You were shocked. You were shocked.
No. Well, thank you so much. This has been a real pleasure to be able to bring this to the public because it's a really important, it's a really popular trend now, and people do have a lot of questions, and they do want to see people who look like them. I do want to shout out our physician associates. I have a lot of friends in derm, both PAs and NPs, and a lot of PAs have actually been in derm a lot longer. So we want to bring attention to those other providers who you can do your research on when you're looking for someone.
Yep, yes, ma'am.
So yeah, I think that's it. So yeah, we'll put all the links in the description box. Everyone can connect with you. Make sure y'all come back for her second episode where we'll dive deeper into her journey as a cosmetic MP. Remember, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, this is your chance to subscribe to our YouTube channel and follow us on every social media platform. Say hello in the comments when you get there. Rate us on Apple and Spotify. It really helps you support the show and get this message out there to those people who really need to hear it. At the time of this filming, we release new shows weekly on Sundays at noon Eastern. And then for our night shifters, remember the audio always comes out at 5 a.m. so that our night shifters can be the first to get something and not the last. And then our day shifters have something to listen to before they start their work. Again, we thank you, Dr. Britt. We thank you, everyone, for watching. We'll see you next time.